Thank you very much. The marching band won't understand this, but some of you will. That's the loudest music I've heard since a Who concert in 1968. Good morning. I'm Jeff Grossman. I'm the rather new CEO of UW Health, and it's a great pleasure to welcome all of you here this morning. So I want to start off by saying, and I take every opportunity that I can, to point out that UW Health is a learning organization. And this building is a great example of that, because for those of you who were here about 2 years ago on a terrible, blustery, windy, cold, and rainy day in April, we learned a lot from that, and we learned that it's much better to schedule things on days like this. So just one example of how we learn. It's been said that good buildings come from good people, and I really believe that's true. And to the extent that it's true, this is a celebration today of not just a good building, but a great building put together by really great people, and you're going to get to know some of them this morning. We're also gathering this morning symbolically to really donate this building to the communities which it serves. If anybody's here from the mayor's office, I say that metaphorically, entirely, but it really is a donation of what we've been able to do to this community. You're going to hear this morning several speakers who are going to talk about the genesis and the purpose and the planning, the extraordinary planning and work that went into building this building. Before that, I want to recognize some people in the audience who, in their own ways, have worked very hard in getting us to where we've come, who won't have a chance to speak today, but who have contributed greatly to this building. So I'm going to start off with a group of distinguished guests from outside UW Health. Samba Balda, who's the Madison Alder for District 17, which is the part of town that this facility is located in. Is Samba here? Yes. Thank you for being here. Paul Esser, the mayor of Sun Prairie. I think we have a number of leaders from our neighbors in the town of Burke. I haven't seen her, but is Regina Milner in the audience? Regina Milner is, I hope, going to be joining us. She is the president of the Board of Regents and on the UWHC Authority Board, and has been very supportive of this. Dr. Bob Golden is with us today, the Dean of the school. The Dean of the School of Medicine and Public Health, and the chair of the new UWHCA, that is UW Health Board, my boss. Zach Brandon, the president of the Greater Madison Chamber of Commerce. Is Mr. Brandon here? Thanks for being here. Jack Salsweedel, the chair and CEO of American Family Insurance. Is Jack here? Yep. Thank you. And I'm delighted that several of our relatively new partners from the Swedish American part of our organization from Rockford have driven up here to join us today. I know Patty Duane and Dr. Tom Schiller are here. And Mike Bourne and Don Daniels, I know, are here as well. It's always hard to find those Swedish American people when you need them. I don't see them out there, but I know that, oh, there they are, okay. All right. Dr. Mark Huth, I haven't seen Mark, but I think he's here as well, from Group Health Cooperative. He's the CEO. Mike Sanders, the president and CEO of the Monroe Clinic. John Russell, the president and CEO of Columbus Community Hospital. And then I just want to introduce a few people who are really part of our UW Health family, some of them employed by us, some who volunteer a great amount of time to us. And three of them are volunteers from our Patient Family Advisory Group, and those are Alan Sweet in the front row, and Peggy Zimdars, and Katie Trachty. These folks and others from their group are in large part responsible for how this place is going to work. And then finally, I want to introduce Wendy Horton, who is a vice president at the American Center, responsible for performance excellence and integrated operations. Vicki Hill, who's also a vice president for the American Center and oversees clinical and interventional services. Just have a couple of remarks, and then I'm going to get us on to our next person. I've well used my 3 allotted minutes, but it's the breaks. So it's been said that we shape our buildings and thereafter they shape us. And I think that that's very true. There is no building in the history of UW Health in which the planning and the building have been so intensely focused on the patient experience. It was our North Star from day one, and will continue to be, this will continue to be a building that ensures that patient experience is paramount. This building, and I keep calling it a building because I'm not sure what else to call it. Our lexicon in healthcare doesn't really yet encompass what this building is. So it's got operating rooms and it's got inpatient rooms, but it's not a hospital. It's got many exam rooms in it, but it's not a clinic. It has extraordinary athletic performance facilities in it, but it's certainly not a health club. It's all those things and more than the sum of those things. And it reflects what healthcare has to be going into the future, which is a construct that always is there to serve the needs of the people we care for. And what may be an operating room one day, maybe an outpatient clinic the next. We're ready to change with you as your needs change and as community needs change. One final quote. I found this someplace. Some architect said this: "We require from buildings 2 kinds of goodness. First, they must do their practical duty very well. And second, they must be graceful and pleasing in doing that practical duty." I think when you get inside the building, you'll see exactly what that means. This is a building that is built to do its duty, to enhance the lives of everybody who walks through that door. But it's also a beautiful building. And we've come to learn, there's just increasing evidence about this, that the built environment, what our buildings look like, how they function, really has an effect, not just on the patient experience, not just whether it's a nice place to come, but it really has an effect on healing and on the outcomes of the things we do. And this building was built with that in mind. And I think as you tour today, you'll see why that's a promise that we think we'll be able to keep. So now that I'm probably on the 10-minute mark, I better move on. So I'm going to start to introduce the people who have really been there on the ground, putting this building together, imagining it, and building it. And first I'm going to introduce to you Mr. Ron Slulinski. Ron is the president of UW Hospitals, and the Chief of Clinical Operations for UW Health, and he's going to talk to you a little bit about the genesis and the history of this building. Ron?